Look, this public option is really, I think, a problem. The government is telling us that this is going to increase competition. Well, that really just seems totally counterintuitive to me. If we're going to increase competition, we're going to create a government-sponsored entity. That entity is going to be subsidized by us. It's going to have no profit motive. So theoretically, its cost to operate, just as an administrative entity, is going to be substantially lower than the cost to administer Blue Cross or Blue Shield, or anyway, it's going to have an unfair competitive advantage. So in the early days, yes, there's going to be some competition between this government entity and the private insurers, but over time, it's going to drive the private insurers out of business. So in the long run, what are we going to be left with? A government-run healthcare program. I don't know about you, but I've not seen any really great government programs that I think are fantastic. Everything that the government touches is inefficient, costs more. Some people will say, well, the military is great. Well, in the military, you're going to pay $500 for a hammer, too. So again, at the end of the day, the thought that this thing is supposed to increase competition is, I think, a fallacious argument. It will, in the beginning it will, but over time it will drive private companies out of business. A better way to approach it would be to open up competition between states. Right now, each state has its own set of rules and regulations, and only certain insurance companies are allowed to do business in a particular state. If we were to remove the barriers and have one set of laws that apply to insurance companies among all 50 states, then we truly would increase competition, and we would increase competition at really no or very low cost to the taxpayers. The government plan is going to cost us money to administer. How much does it cost to administer Medicare? I mean, it's probably huge. So why don't we take small steps? Let's eliminate the differences among states, open up competition so that the private market can do what it does best, reduce cost. I mean, we do need other rules, regulations, to the insurance companies. We need to regulate the doctors to some extent. They will. It's not unheard of for a doctor to give you a low cost if you don't have insurance, and a much higher cost if you do. So we need to regulate doctors. We need to regulate the insurance companies. But let's please not let the government run our programs for us, because if we do, in the long run, we're in for some really, I think, really tough times.